My guest joins me to discuss her career journey and current role as the Chief Scientist for Public Health and Epidemiology at MITRE, which is the organization that everyone in public health should know about. You're listening to the PHEC podcast, episode 331. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. This episode is part of a special sponsored series of episodes where you'll learn about MITRE through my conversations with leaders across their organization. MITRE's mission-driven teams are dedicated to solving problems for a safer world. The stories and the interviews are fascinating. My guest on this episode is Dr. Rakhee Palekar. She joins me to discuss her career journey, including how she discovered public health and her work at MITRE. I think that all of you will find this episode filled with interesting and valuable insights. Now, let me fully introduce her now, and then I'll connect our conversation. Dr. Rakhee Palekar is a medical epidemiologist with more than 20 years of clinical and public health experience. She is currently the Chief Scientist for Public Health and Epidemiology at MITRE. Prior to coming to MITRE, she served as a CDC Epidemic Intelligence Service Officer at the Maryland State Health Department and thereafter worked in the CDC Influenza Division for many years. Most recently, she led the Influenza and Respiratory Virus team at the World Health Organization Regional Office for the Americas. In these public health roles, she investigated many infectious disease outbreaks in various settings, developed surveillance strategies, managed large grants, and engaged with stakeholders from ministries of health and agriculture throughout the world. She also worked to support the development of pandemic preparedness plans and influenza vaccine policies. Prior to her career in public health, she was a clinical associate at Duke University and worked at a federally qualified health center in Durham, North Carolina. She has co-authored more than 30 peer-reviewed publications. She holds a BA from Wellesley College in Psychobiology and Economics, an MD from The Ohio State University, an MPH in Epidemiology from the University of North Carolina at Chapel Hill, and is a diplomat of the American Board of Family Medicine. Let's connect my conversation with Dr. Palekar right now. So, Dr. Palekar, thank you for taking some time and coming onto the podcast to share about your work. I'm excited to get to know you. So, welcome to the podcast.
Thank you so much. I'm so excited to be here today.
Wonderful. Let's start with you telling us a little bit about yourself.
Okay, perfect. So my name is Rakhee Palekar, and I'm a medical epidemiologist. That's a term that sometimes doesn't make a lot of sense to folks. But to break it down a little bit, I'm a primary care physician first and an infectious disease epidemiologist second. And so those come together under this term, medical epidemiologist. I'm currently the chief scientist for public health and epidemiology at MITRE. But before coming to MITRE, I was with the World Health Organization for many years doing flu and respiratory virus work. I was also with CDC for a long time in their influenza division, also doing preparedness and response work specifically related to influenza. And before that was a practicing primary care physician in an academic setting. And so really bring all of those experiences to where I am today.
That's amazing. I love the background. And I think those diverse perspectives create a real strength and a unique lens, for you to do what you're doing now. So one of my favorite questions to ask as I interview guests on the podcast is, sort of this retrospect, taking a step back to see how did you get here to better understand, the journey and the pathway. So the question is, when did you first learn about or become interested in public health?
Yeah. So that's an interesting question because it's sometimes hard for me even to figure out, sort of exactly, what was that inflection moment when I pivoted my career a bit, or sort of what were the exact whys for doing that. But so, when I was in medical school, I was really interested in primary care and specifically community medicine. And so that was ultimately the postgraduate path that I pursued. And I really wanted to work in an academic setting because I was interested in not only sort of the delivery of clinical care with this community lens, I also was really interested in teaching. So I wanted to be working with medical students, with residents, with fellows, et cetera, who are on different stages of their medical education journey. And I was also really interested in research. And so I sort of saw the best place, for those things to come together in an academic institution. And so was really intent on sort of pursuing that pathway for my clinical career. And I did that and really enjoyed it. But then life happened a little bit in the sense that my husband was looking for a job. And so we were going to be moving away from the academic institution where I was working. And I serendipitously met a really wonderful person, Dr. Stephen Thacker from CDC, who happened to be very close friends with the chairman of my department at the time. And he really encouraged me to think about a career in public health, and specifically to consider applying for the CDC Epidemic Intelligence Service program, or EIS program. And this was a program that CDC had implemented in the 50s, which really was a way to bring, at that time, primarily physicians into the field of public health. But over, the last 70 years or so, this had really grown to be a way to bring multidisciplinary thinking to public health, and for folks that were in potentially diverse fields outside of kind of immediate public health to have a field experience with public health and sort of understand what the public health ecosystem looked like and how they could contribute their skills to public health. Fast forward, I did end up applying for the EIS program and was accepted to the program. And so then I had to choose what type of assignment I wanted at CDC. And so the opportunities were somewhat pathogen specific. So you could do something in a specific area like hepatitis or influenza or malaria. Or you could choose a sort of broader based experience, for example, in a state or a local jurisdiction. And because at that time I was still, sort of on the fence or not really knowing, was I going to, continue sort of the clinical career, in sort of an academic arena, which I very much enjoyed, or, did I want to think about this public health career? I opted for an assignment at a state. And so I was based in the state of Maryland for 2 years, and I worked at the Maryland State Health Department, primarily with the state public health veterinarian and the state epidemiologist. And these two folks were just fantastic mentors to me. One was a physician by background, one was a veterinarian by background. And so I was really able to see over those 2 years how those two individuals were able to bring their expertise in clinical medicine and veterinary medicine to public health and really have a very big impact. And because this was a state-based position, I was able to work across a multitude of different topics. So there were certainly important policy aspects. I investigated a lot of outbreaks. We wrote clinical guidelines for clinicians in the state of Maryland. I worked in vaccine preventable diseases, really a diverse variety of issues. And, knowing that my background was in primary care, you can probably guess that, opportunity to work on a wide variety of issues was something that was really appealing to me. So I found myself sort of getting pulled increasingly in that direction. While in this 2-year position with CDC, I also had the opportunity to go abroad and work with the Rwandan Ministry of Health to stand up an influenza surveillance system for them. They hadn't had any surveillance for influenza before that. And so CDC was invited to support them in these efforts. And I was fortunate to be able to do that. And so I spent many months in Rwanda over the course of this 2-year EIS experience. And ultimately, was offered a position within the influenza division at CDC and opted to stay on. And that, somewhere, in those moments, I, really shifted toward this career in public health. And then, as I mentioned, stayed on with CDC for many years and then was with the World Health Organization, doing some of the same type of preparedness and response work. And so it's been a journey, but a really wonderful one. And I'm so grateful to, all of the wonderful mentors that I've had over the years who've helped guide me along these paths.
Yeah, that's a great story, fascinating journey to hear. We often, especially on this podcast, hear when I ask that question, people will say, well, they started out pre-med and then discovered public health and then
Right.
pivoted over. So it's
Right.
really interesting to hear you, go as a physician discovering public health and then how you, have really merged the two extremely well. And I really like that. Also love hearing your multiple interests. You've got this diverse interest and this is a field that's very broad and you're literally connected the dots, every step of the path for it. So that's been really great to hear. And as you were explaining, I was smiling and nodding. I also had Dr. Eric Pevsner on the podcast years ago because of the EIS program. And he talked about that specifically, the program, recruitment, and used the show notes for a long time. And over the years, as I would catch up with him or talk to him, he said, there's so many students that have come through the program that said they first heard it on this podcast. So
oh my gosh,
to
amazing.
hear that a part of yours is really kind of full circle. That's really nice.
Yeah, that's fabulous. I love that.
So with having such a diverse, set of interests, is there a particular condition or population or public health problem that you are most passionate about?
Yeah. So again, with my background, there's a lot of different sort of gravitational pulls that I have. And certainly given that I worked in flu and respiratory viruses for many years, and then, obviously we all just lived through this pandemic over the last several years, that continues to be, an area where I'm, just find myself really focused on and feel that there's so much that we need to be doing and could be doing. I think as far as a specific content area, though, which is somewhat newer to me, but one that I think is really important, and I'm really working to think about how we as MITRE, and certainly, I individually can kind of contribute to this threat space, is the challenge of antimicrobial resistance. This is something that I would say for most folks is not on their radar, neither, sort of in the public health world, nor in the clinical world, and probably not, even in our communities. And it really is, I firmly believe, a silent pandemic. It's something that's happening in the background, and it really is an existential threat for us, right? Because if we think, what would it be like to go back to the pre-antibiotic era, right? What would that really look like? We've come so far, and, we really don't think much about this threat. And so I think that for me, this is one that's really front of mind. I think that it started to sort of emerge in my mind as being important, certainly as a clinician, when I was thinking about, trying to judiciously prescribe antibiotics. But I think from the public health standpoint, I remember back in 2009 when I was working in the influenza division on flu, one of the seasonal viruses. So I won't go into a long academic instruction about flu viruses, but, there are several that circulate during any season. And one of them became wholly resistant to oseltamivir, which is an antimicrobial agent that we use for either treating or sometimes, give to folks who've been exposed to help, alleviate the likelihood that they might develop a flu infection. The virus became wholly unsusceptible to that antimicrobial. And that was really shocking, and led to, a lot of important communications with clinicians, amongst the public health community, having a lot of conversations. And so that was really my first taste of sort of at the public health and sort of bigger population level, what things can look like if we have, a pathogen that becomes resistant to the tools in our toolkit. And I think the reason that this topic is of particular interest and importance to me is because I think a lot of people say, well, we need to develop more antibiotics. So let's, think about how we can support the pharmaceutical companies to do that. And that's certainly important, but it's really one part of the solution and not the only solution. The other pieces in my mind are equally important. So we need to have, for example, better situational awareness. We need to understand, where are these resistance, patterns emerging, with regard to which antibiotics, with pathogens, which population. So we really need better situational awareness. We need to be thinking more intentionally about stewardship efforts. So how do we really work with our clinicians, and not only human clinicians, right? Because antibiotics are prescribed also to animals routinely. They're, used, different types of antimicrobials are used for crop growth, right? So we need to be working across the ecosystem to more judiciously use the antimicrobials that we have at our disposal. And I really love to kind of pull in the notion of One Health thinking to this. It's something that we talk about a lot in flu, but, it's really important here as well. And that's the idea that, we're all existing in one sort of common ecosystem. And so we need to think about, we need to understand our ecosystem as such. The things that we do have downstream repercussions really across this big ecosystem. And so we need to think about our environment that way. And then finally, medical countermeasures, as I mentioned, those are important. We do need more antibiotics, certainly, but under this, medical countermeasure umbrella, we also need to think about, for example, bringing better diagnostics to the bedside. So how can we have better diagnostic testing in clinicians' hands? So, for example, when they're having that conversation, potentially with a parent about not giving antibiotics for the child's middle ear infection, right, that they can actually hang their hat on a test and say, this is a viral etiology. We don't need an antibiotic. And, you can be confident that that's what's going on, parent, because, we were able to do this test at the bedside. So I think it's really, sort of this multi-pronged solution, with this One Health lens that we really need to be approaching this threat with.
I love everything you just said. You're really speaking my language. I'm an old microbiologist, so I did clinical microbiology. And
amazing.
Hospital labs. And some of my early project was on collecting, or I did, the testing for microbiology, respiratory wounds, all the blood cultures. So we would collect certain specimens that were, early stages of, in investigating MRSA. So methicillin resistant Staphylococcus aureus. So this is before we had the multiple levels of resistance.
Right.
And we were just beginning to collect and thinking about the implications. And fast forward, as you were talking, I was already thinking about One Health. And when you mentioned, your background and the work you had done with veterinary medicine and the community level. And as you were beginning to explain, antimicrobial resistance. And if you hadn't mentioned it, I was going to ask, had you thought about the concept of One Health?
Right.
So all important that you just mentioned, and some are already also, just kind of intriguing to me as well. So interesting topic, to say the least.
Very interesting topic. And I'll maybe just offer as sort of one, last point on that, we do have Antibiotic Awareness Week, I think is what it's officially called, coming up in November, and the focus is, really on sort of that One Health thinking and One Health approach. That's sort of the focus of this year's Antibiotic Awareness Week sort of campaign. So I just wanted to say that piece as well as you were talking. That reminded me of that.
I wrote that down. I will be exploring that as well. I am just excited. I think you and I are going to have to keep in touch.
I would love that. I would love that.
So let's talk a little bit. You've touched on, your alignment with your passion and interest with work at MITRE and MITRE's views. So let's talk a little bit more about MITRE. How long have you been there, and tell us more about your role there?
Yeah, perfect. So I've been at MITRE for about 4.5 years. It's been a whirlwind in a good way. One of the things that I'm just delighted by every single day at MITRE is the opportunity to work in a multidisciplinary way. I think that's said a lot and in a lot of different places, and it certainly was said a lot by me and a lot of other positions that I had. But I think this is really the first chance I've had to work in a truly multidisciplinary way. The different capabilities and expertise that, we're able to bring together to solve, really complicated, thorny challenges has really been sort of the thing that gets me out of bed every morning, because I am just learning and growing every day as a consequence of working with folks that are in other fields other than the one that I'm in, to see a problem in a different way from maybe how I thought about it for the last 20 years. At MITRE, my specific role, as I mentioned, is as the chief scientist for Public Health and Epidemiology. My position sits specifically in one of our innovation centers in the Health and Society Innovation Center. And I really have a fair amount of flexibility in terms of the types of things that I'm engaged in this role. So if you're familiar with MITRE, you might know that we operate federally funded research and development centers, or FFRDCs, and we operate the FFRDC for HHS, the Department of Health and Human Services. And so because of that, I have the opportunity to work very closely with a lot of the different HHS agencies. I won't enumerate the alphabet soup of, the many that exist, but some of the places that I spend a lot of time are working with HRSA, the Health Resources and Services Administration, because one of my previous clinical roles was working in a federally qualified health center. So really have a passion, as I mentioned, for community medicine. And so been really fortunate to work closely with HRSA and support the work that they're doing with health centers and to improve healthcare access. I also spend a lot of time doing work with CDC. But then I've also been outside of the HHS arena as well because we operate other FFRDCs. So also have had the opportunity to work, for example, with the FAA or with the DoD as other kind of non-traditional health sponsors. So do a lot of work alongside with the federal government, but also have been really fortunate to work with academic partners as well as industry partners. And in terms of the public health piece, I've also been able to work both state and local jurisdictions. So really a lot of diversity, and I've been really grateful for the opportunity to contribute on, multiple different projects and collaborate with really multiple different folks, really amazing folks over the years.
That's what I hear often. And when I meet with folks at MITRE is this interdisciplinary type of work. And everyone is excited about that. And I get it, especially when you bring such a diverse background, next set of expertise to the table to be able to feel that you can pour in and use all of that, in your role. What are some of the programs, if you're, as much as you're able to share about that you're responsible for, you're able to describe, any of that in more detail?
Yeah, well, maybe not specific projects. I'm happy to get into projects. I don't know if that's too much in the weeds, but maybe one thing that I'll mention that's internal to MITRE that might be interesting to folks is, so coming out, or I shouldn't say coming out, but, as we started to understand sort of where we were in the pandemic and started to think a lot about, how does public health sort of continue to intersect with all of our daily lives? One thing that we decided to do was to start an epidemiology community of practice at MITRE. And there was so much interest in a way that I really hadn't seen before in public health and epidemiology specifically at MITRE because of what everyone had lived through in the early stages of the pandemic. And so it was really an opportunity to channel all of that energy and interest into one group that sort of cut across all of the different areas that we have at MITRE. And we're a big organization, right? So 10,000 folks, many of whom were engaged somehow in work that touched pandemic response. And so we stood up this community of practice, and it really is a place, for people to come together and discuss public health issues of relevance, to share lessons learned, and really, get smart sometimes about different topics that they might not be familiar with. And so I'm going to tie this back, to also this piece about antimicrobial resistance, because one thing that we did last year was we did a 3-part series under the One Health umbrella. And antimicrobial resistance was one of the core topics that we decided to cover as part of that series. And it was really wonderful to see the diverse representation that we had as far as folks that were coming from so many different disciplines and wanting to learn about this topic. And so I think, because of who we are and how we work at MITRE, I think we really have an opportunity to lean in on threats and challenges that really need these types of multidisciplinary solutions. And so, that's one piece, that I've been responsible for, is for running this community of practice that's internal to MITRE. I think another effort that I maybe would like to mention is something that MITRE did in the early stages of the pandemic. It stood up something in partnership with the Mayo Clinic called the COVID-19 Healthcare Coalition. And so if we can, fast forward or rewind, I should say not fast forward, rewind back to thinking about, where we all were in March of 2020 and sort of remembering that uncertainty. And at the same time, everyone, sort of wanting to find a way to contribute in that, sort of space of uncertainty. So from a professional standpoint, MITRE sort of thought, well, what can we do to channel all of that energy and sort of desire? And so we brought together with the Mayo Clinic 1,000 organizations, private sector as well as academic partners, to participate in this COVID-19 Healthcare Coalition. And I was fortunate to be able to lead 2 working groups that we stood up. So I led the testing working group as well as the contact tracing working group. And so one of the important, I think, accomplishments of this working group, for example, on the testing side of things, was we can remember back, March, April, when there was really a paucity of information in terms of, where could we all get tested? Where were tests available? And so the ArcGIS core group actually did an amazing thing, and they built a database where they were tracking, testing sites on a daily basis, the testing sites that were being stood up, the ones that were being sunset, and we're maintaining this database. And so we decided as a working group to basically bring those data over and build a dashboard where then folks could see where testing sites were located. But more importantly, we were interested in the sort of policy aspect of where there might be testing deserts or where were there testing inequities. And so some of the messaging that we used around this tool was for decision makers to use this tool potentially to help them make decisions about where they might want to position testing. And then the other piece that we layered on was we took, for example, the social vulnerability, SVI or social vulnerability index from CDC, and layered that on, to the data points about where testing sites were located to better understand, when we were thinking about, communities that had different types of SVI indices, how did that, sort of layer against the location of testing sites? And again, what could decision makers do with these types of data and these types of insights as they were making decisions about where to stand up testing sites? And then maybe just with regard to the contact tracing working group, obviously one of the things that came out of the pandemic, I think, and this is probably a silver lining amongst the many, challenges, and difficulties that, we all really experienced, over this 3-year period, was the opportunity for tech to support public health. While I think this was happening, in small pockets in different jurisdictions, there was really a big push, and I think now a big opportunity space as a consequence to think about how tech can sort of support public health. And so one of the things that we did at MITRE is we ultimately partnered with Apple and Google on some of their exposure notification app work, and MITRE specifically built something that we called ENPA, Exposure Notification Private Analytics, which was really the engine and the dashboard that pulled all of the telemetric data that folks that were using the app and had opted in to share their data were generating. And we used those data points to build a dashboard for public health, ultimately to use to inform their decisions about, where did they want to spend, their resources and time and things like that in terms of contact tracing. So hopefully that gives you a little smattering. You can probably guess that I could go on and on.
Oh, this is fascinating. And I appreciate you sharing that because I think it does put really practical examples of the type of work and to give a sense of what MITRE is capable of and how it's leading. So those are really great examples for us. I appreciate that. We just have a couple more questions for you as we sort of start to wrap up. Thinking about the fact that we have a very diverse audience of listeners who may be listening and really interested in working in your niche or doing something similar. Do you have any type of advice that you could share for someone who may be listening to us right now and really curious or wondering, how do I begin to go that route and do some of the things that she's doing?
Yeah. So I guess the first piece, and this probably has already come through with everything that I've said so far, is there is so much to public health. So there really is an opportunity, to work in public health yourself, to be a partner to public health, to build tools that can support public health. So there's so many ways I think that folks can, if they have an interest generally in this area, can find a touch point. But I think if you have a direct interest in public health, I think one of the best things to do is to try to get some field experience or hands-on experience just to see, which part of this big ecosystem, resonates the most with you and sort of which is maybe even just the area that you want to start in, right? Because I think certainly my story is an evolution story. And I think there's opportunity to, certainly in public health, to, kind of evolve yourself and find new and meaningful ways to contribute. So I would say trying to get sort of into the ecosystem and sort of understand what it's really like and use that as a way to figure out what is most interesting and what resonates with you the most is probably the best advice that I can give, and advice that I give certainly when, folks ask me about this. It's a question that I'm asked frequently, and I think that's really the best thing to do. And I think also, to tie this maybe a little bit back to the pandemic, I think a lot of us were surprised when we saw during the pandemic some of the challenges that we were facing in public health, right? Because I think it's not a world that, it happens silently in the background, keeping us healthy, trying to promote the best for everybody. And I think that, it's something that folks maybe weren't tracking to as closely before the pandemic. So I think also getting into that world and sort of seeing, what it's really like, what are some of the real challenges, and some of the ways that there is opportunity, I think would be a really meaningful and useful way for folks to spend time if they're interested in pursuing a career in public health.
Excellent advice. Thank you so much. I appreciate the time that you've taken and being so generous in sharing insights. And there's just a lot of great takeaways in all that you shared. And I appreciate you. So thank you for being here.
No, it's my pleasure. This has been super fun. I hope that I have said something that's valuable. And it's such a privilege to have the chance to talk with you today and to share my story with your audience. So thank you so much for the opportunity.
I really hope that you enjoyed the conversation as much as I did. I also hope that you found value in the insights that Dr. Palekar shared with us. I do encourage you to connect with and explore MITRE and learn more about what Dr. Palekar shared with us on this episode. We've gathered all the links together in one place on the show notes page to make it really easy for you to access. Just visit the show notes page for this episode, which is episode 331. Go to phecpodcast.com. And from there, just navigate to episode 331 and you'll find the show notes. One more thing before we go, please take a moment and share this episode with a friend. I'm sure you know at least one person who would be interested in hearing this conversation. Probably more than one person, but at least one person. If you're listening right now in one of the podcast apps, then you can easily share this episode through a text or share it in a post on social media. At the bottom of the show notes page, if you happen to be there, you'll also find social media sharing buttons, which make it super easy to share this episode with your network. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.